Up to now, I can see that there is positive feedback. Previously, young people were not able to talk about sexual reproductive health issues openly because, according to our culture, it seems like a taboo.
Frederick is a 28-year-old fully trained expert in sexual and reproductive health and rights. He has helped up to 500 young people in Bangwe township within Blantyre City, located in southern Malawi. These young people have been helped with access to contraception, support and vital sexual health information under the auspices of ACTIVE with funding from SAfAIDS. Malawi has made progress in increasing its overall modern contraceptive prevalence rate since 2000, resulting in a dramatic reduction in its total fertility rate. However, there has been very little progress amongst the youth aged between 15 and 24 years of age. Teenage pregnancies are on the rise, and little progress has been made in reducing unmet need for family planning among youth. With 2/3 of the population under the age of 25, and with Malawi's rapid population growth, reducing unmet need for family planning among youth remains a priority for the government of Malawi's reproductive health agenda. In Malawi, nearly half of girls marry before they are 18. Only 37% of young women between the ages of 15 and 19 have completed their primary education, with many girls forced to drop out of school to help look after relatives, find work to support their families, all because they fall pregnant. The lack of comprehensive sex education and information about sexual and reproductive health and rights makes it extremely challenging for young people to access their rights to reproductive health services and achieve gender equality. Now, in order to bridge this information gap, SAfAIDS, under the Transforming Lives program, has been working to build a policy environment that ensures sexual and reproductive health and rights for all. The program is built on 4 strategic pillars: policy development, policy advocacy, social accountability, monitoring of sexual reproductive health, and regional evidence and knowledge sharing. In Malawi, the program, dubbed Transforming Lives for Accelerated Access to Sexual Reproductive Health Services by Adolescents and Young People, has for the past 3 years been implemented by Active Youth Initiative for Social Enhancement AYISE here in Bangwe Zone within the city of Blantyre.
We have a problem in Malawi. We have so much teenage pregnancies, so much unplanned pregnancies, unsafe abortions, and a high population. All of these are as a result of young people not having as much access to sexual reproductive health services. This does not mean that the young people don't go to the hospital. This does not mean that the Minister of Health is not doing much. No. The Minister of Health is encouraging young people to go to the hospitals. But the challenge is, are the hospitals friendly? Have they put themselves in a manner where young people can access the services? You know, for health of young people in a facility, it's not necessarily about malaria, tuberculosis. For young people, most of the health needs that they want to visit the hospital for is about access to condoms, access to pregnancy pills, access to family planning methods, STI treatments, HIV testing, cervical cancer testing. So you will find in a majority of these circumstances, a young person is going to hospital but is not looking sick. But in our ordinary sense of hospital is that you have to go to the hospital when you are looking sick. So many hospitals still are in a situation where they feel if a young person comes, what are you suffering from? And the young person says, no, I want to have pregnancy prevention pills. They would say, would you please wait a while, we should deal with more sick people than you. It's like the health needs of young people are more of a luxury than a problem. And yet, if you don't provide the pregnancy prevention pills, if you don't do the STI treatment, that's where now the health problems begin.
In order to seriously address the attitude problems among health workers, AYISE, through its social accountability pillar of the Transforming Lives program, has been engaging civic leaders in the public sector within the Blantyre City Council for improved performance and good governance. Several dialogues have been held to address challenges bordering on the access to sexual reproductive health services at the public health centers such as Bangwe Health Center.
We were targeting our interventions, encouraging young people to go and access services at Bangwe Health Center. And at the same time, we were working with the service providers at Bangwe Health Center to improve the friendliness to the young people so that there is a reciprocal attention to the issues. Now, from the project interventions, we had the community mobilization and youth mobilization, which means we were encouraging parents to encourage young people to go to the hospital, but also encouraging the youth by themselves to go to the hospital. We also had programs to do with training of youth champions. So these are young people who have been selected from all the parts of the community. They were 20 in number. They were trained to mobilize and to register young people on a mobile application. And so the third intervention was the engagement with policy makers and duty bearers to improve service provision. Then the key element was what we call social accountability monitoring. We were now questioning the service providers. Are they doing enough to make sure young people access the services? Are the drugs, are the services that young people need in a health facility available? And we are glad that the stakeholders and the duty bearers out of this project have been very responsive, and the services have improved greatly. The attitude of the workers has improved, and many young people have registered on an application called SAfAIDS, which simply registers young people who attend to the health facility, and if they have met some problems at the health facility, they are also able to report the challenges that are being faced using a mobile application.
This is a reflection meeting to evaluate what the program has achieved in its implementation phase. Here gathered are civic leaders from Blantyre City Council, block leaders, health workers from both public and private, youth network leaders, as well as social accountability monitoring champions, commonly known as SAM champions. Making his contribution, one of the civic leaders, Councillor Isaac Jomo Osman for Bangwe Mtandizi Ward, pointed out that it is pleasing to note from presentations that more young people are showing increased awareness of their rights to access sexual reproductive health services from public hospitals. He says establishment of SAM champions within the program has equipped many young people with the skills needed to take a leading role in canvassing their peers in accessing sexual reproductive health services.
When you go back, you will see that a lot of young guys were afraid to go to the public hospitals because the services that they were receiving there, they were not happy with it. So the coming in with this program has introduced a lot of young guys to go to the public clinics and get the services, because they know that when they go there, they'll not just go to the public. They have their own, they say what, youth corner, where they can receive a special treatment.
The district youth officer for Blantyre, Martha Chelewani, says the increased number of young people accessing sexual reproductive health services in Bangwe Township is an indication that there has been a major response and mindset change among the adolescents and young people insofar as sexual reproductive health services are concerned. She, however, points out that many public and private health centers in other townships within Blantyre City continue to report few cases of adolescents and young people in accessing sexual reproductive health services due to lack of awareness on their right to access these services.
I urge all the donors, a lot of donors, to come in and support HIV's project, SAfAIDS project among young people. And also have a challenge in Blantyre as a whole, challenge of donors, stakeholders. There's a stakeholder but so a lot of partners, they don't want to come in the city and implement their projects. They just think that in urban, I think the people, they are already aware of a lot of things, but it's not like that. So I urge a lot of donors to come and support youth programs.
One of the block leaders from this area, Group Village Headman Muhammadi, said there has been a drastic reduction in the number of girls having unsafe abortion or childbirth complications resulting from teenage pregnancies. She said the increased number of deaths among girls and childbirth complications among teenagers is an indication of lack of sexual reproductive health and rights information.
Asasire bomwebo kuti achinyamata nawo sapite pasogolo kwa achinyamata ndi sogolo atula mawa kuti ntchito zimene tikugwira ife nthawi zino isogolo munawo sazakhala kugwira ntchito zimenezi.
This is Francis Malunga, an HIV testing service officer and a youth-friendly health service provider working at Bangwe Health Center. Francis has for the past 3 years been working with some champions from AYISE under Transforming Lives program. Unlike in the past, in which a month would pass without registering a young person seeking reproductive health services, the facility now attends to more than 100 youths per week who come seeking various sexual reproductive health services.
Comparing to the past quarterly, we can say this time around we are improving much, and the numbers are quite large enough as compared to the previous quarter. So this has been because of our colleague AYISE project, whereby they have their capacity to mobilize youth in the community to know that at Bangwe Health Center we are providing such services. As such, we are receiving a good number of youth coming here to receive those services.
Timothy Mukandawire is another HIV testing service officer who observes that youth-friendly health services and these kind of interactions provide a right platform for young people to acquire the right information rather than being fed with myths by their peers, a thing which has helped in the surge of STIs and unintended pregnancies.
Like in RRT, it's like they help them like in Fridays, we're having like teen clubs. Saturdays, we're having youth-friendly clinics. So they're supposed to come here to give talks, healthy talks. We are supposed to encourage them like to have protected sex intercourse. They also come to get contraceptive pills, like like that, and I think so helped.
On the question as to whether these awareness sessions on sexual reproductive health services among young people was encouraging them to indulge into teenage sex, Yamikani Chipazi, chairman for Blantyre Urban Youth Network, says this was not the case, but a requirement, as Malawi's National Youth-Friendly Health Services standards state that all young people should be able to access health services and health information. He says the policy states that the information on sexual and reproductive health should, however, be appropriate to the needs that service providers must have the required knowledge, skills, and positive attitudes to provide youth-friendly health services.
People in Malawi, whether they know, whether they don't want to know, but the young people, they are into sexual activities, whether we're going to accept it or not. So, since they are into those things, we are supposed to give them time, the access to these services. Because if we're not going to do that, we're going to put their lives in danger. So there's no kind of any comprising or whatever, but it's really important because the sexual activities on young people, they're happening.
Betha says the program has equipped her with necessary skill to interact with peers and share the importance of accessing quality sexual reproductive health services from public health centers. She adds that the component of strengthening youth-friendly health services at Bangwe Health Center, as well as other private clinics within the township, has resulted in the increased number of young people seeking sexual reproductive health services such as contraceptives.
As young people in the community, we are looked as we don't have a word to say to the community, but we need to voice out, we need to speak out, we need to stand that the community, we are there, and the community is us in the youth. And if we voice out to our fellow youth, we also help the other part of the community, as in parents.
On this material day, some champions stormed Bangwe Market, where they were able to engage young people on the importance of seeking sexual reproductive health services from health centers.
Previously, young people were not able to talk about sexual reproductive health issues openly because according to our culture, it seems like a taboo. Like I cannot openly talk to my aunt or my uncles about issues to do with emergency pills or condoms or sex. But now, it's not only young people whom we have been dealing with, it's also the elders. Like when we're moving in the communities like this, most of them, they're elders. They'll call us, then they'll ask us, what are you doing? When we explain to them, they'll actually invite us to their homes. Like, you can explain this to my to other young people. I know I can explain them myself, but then it will be better understood by you as a fellow peer. So I can see there's a great change. There's a great change.
Edson Mlandu is another SAM champion who has, through Transforming Lives program, learned how to engage young men in sexual and reproductive health as another strategy for combating harmful gender norms and improve gender equality broadly. He adds that ensuring both boys and girls are able to take advantage of opportunities throughout their lives has helped to address the risk and protective factors that influence sexual and reproductive health behavior earlier on in life.
A lot of young people are now aware and having a lot of information based on sexual reproductive health and rights. Some of the young people were not able to understand what is all about SRH because they didn't even know that it's their right that they have the capability or capacity to go to the hospital and receive the service freely. So after this program, which has been implemented by AYISE in the partners with the SAfAIDS organization, it has now provide a clear information to these young people that they have to understand that the service that the government have provided are for those young people that can access this sexual reproductive rights. So with the coming of some champions, we as some champions, we are the ones that we have been mobilizing these young people to go to the hospital and access these services.
Witnessing the canvassing exercise by some champions, the Malawi country focal person for SAfAIDS, Mary Kumwenda, says she is impressed with levels of high-quality engagement with other young people. She says the Transforming Lives program has demonstrated that it is possible for young people, adults, communities, civic leaders and others to work together to nurture protective factors.
The main objective was to accelerate access of the sexual reproductive health services to the youth. So looking from the time the project started like 3 years ago to now, when you compare at the beginning and now towards the end of the project, you can see that more youths now are able to access the SRHR services from Bangwe Clinic. And that also has given us a good impression of about the impact this project has been to the youth around Bangwe area. So we are quite very happy with the progress and the impact that it has brought to the youth of Bangwe area.
Now that the Transforming Lives program is coming to an end, Mary believes that all stakeholders within the implementation phase, such as Blantyre City Council, Blantyre District Health Office, youth network organizations, civic leaders, as well as block leaders, will continue to implement comprehensive sexuality education and expand youth-friendly health services for all young people.
Despite that the project is coming to an end, we urge the Minister of Health through the Blantyre DHO that they should really sustain this project, because as the process which we have, the youth are able to know about the sexual services, and also the other thing is education. Information is being given to the youth. They are able to make their conscious decision about their bodies and the kind of services that they want to get from the Bangwe Health area.
Lessons emanating from a small area of Bangwe Township in Blantyre on the Transforming Lives program has proven that Malawi can expand its successes by making investments in the sexual and reproductive health of its young people a priority for national development. For example, preventing early marriage and childbearing not only protects the human rights of young girls, but also supports investments in schooling by increasing the likelihood that a girl will complete her education.
All the project interventions were being implemented by the group which we call Youth Champions. These are youth champions for sexual reproductive health. They were the ones mobilizing their fellow young people to go to the clinic. They were the ones registering young people on the mobile application. They were the ones making referrals. If a youth has not been properly received at a hospital, or if the services are not available, there is a book, which is a referral book. They would sign and bring it to the hospital to request the hospital to send the young person to better services elsewhere. But they were also the ones making reports if the youth has not been properly received. So then they would send a report on a mobile application, and that report would mean instantly the district health office, the Blantyre City Council, AYISE, and the health facility head, all of them would know that a particular young person has not been well received and he is complaining about the behavior of a certain worker at the hospital. And all these have actually been implemented by the young people themselves. So this initiative was youth-centered. And I think at the end of everything, we want to share these lessons, that if young people are mobilized to access the services, and if we make health facilities youth-friendly, many young people will go there and access services. And if they access the services, we will reduce prevalence of teenage pregnancies and planned pregnancies, but at the same time we will reduce the population, so that the population should be consisting of the people we want. It should be children by choice, not by chance, so that the children that get born in this country, they should be those children that the couples themselves want, not because there has been a mistake and then a child is born. Because that child, it means no one has prepared for their education, for their growth and development. And that's where poverty begins.
SAfAIDS, through Transforming Lives program, supports SADC policy makers to strengthen the policy environment, develop response guidelines on sexual, gender-based violence, and advocate for the prevention of unintended pregnancies and unsafe abortions among sexually active adolescents. The program has also contributed to the realization of the Sustainable Development Goals number 3 on good health and well-being and 5 on gender equality, as well as making linkages to targets under SDGs 10 and 16. It also contributes to specific targets towards achieving SDGs 1, 3, 4, and 10.